Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we're going to look at common genitourinary conditions relevant to PT practice.
First, let's start with a framework that helps us determine the cause of the patient's symptoms. We can use the location of pain to identify the likely organ, then determine whether the condition is acute or chronic, and lastly look at key features. This includes pain, urinary changes, such as frequency or urgency, and systemic symptoms. Overall, we can then use this framework to create a triad for each condition.
Okay, let's look at a list of common GU conditions most relevant to physical therapists. These can involve structures like the kidneys, bladder, and urethra. As we go through these, we'll continue to use our framework to understand how they present and when referral is needed. Now, let's start with pyelonephritis. This is an acute kidney infection. Pain is typically at the costovertebral angle and is more constant and deep. Since this is an infection, key features include constitutional symptoms such as fever, chills, and possibly nausea or vomiting. They may also experience urinary symptoms such as dysuria, but this is not a defining characteristic. This is an important condition to screen for because the chief complaint will likely present as back pain, which we treat, but it is an infection, so it requires an urgent referral. The triad is fever, flank pain, and nausea or vomiting. With that in mind, let's look at a quick special test for pyelonephritis. This is costovertebral percussion, also called Murphy's percussion, not to be confused with Murphy's sign for the gallbladder. Place your hand over the costovertebral angle, then use the ulnar edge of your other hand to deliver a gentle percussive thump. Be sure to compare both sides. A positive test reproduces pain at the costovertebral angle and may indicate kidney involvement. Building on that, let's move on to another acute kidney condition, kidney stones. These present with an acute onset. Pain is usually at the costovertebral angle and often radiates to the abdomen or groin. The pain is colicky and intermittent, and patients are often restless and unable to get comfortable. Key features include hematuria, and importantly, unlike pyelonephritis, fever is typically absent in patients with kidney stones. This is also an urgent referral. The triad is flank pain, radiation to the groin, and hematuria. Next, let's look at acute kidney injury related to rhabdomyolysis. This occurs when muscle breakdown releases substances that can damage the kidneys. Onset is acute, often following intense exercise, but there are numerous other causes like trauma or prolonged immobilization. Pain is typically in the muscles rather than isolated to the kidney. Key features include severe muscle pain, weakness, and dark-colored urine. Note that the muscle pain is immediate and progressively worse, as opposed to delayed onset muscle soreness or DOMS. This is an urgent referral requiring immediate evaluation due to the risk of kidney failure. The triad is muscle pain, weakness, and dark urine.
Let's move on to bladder conditions, beginning with incontinence. Stress incontinence occurs with increased intra-abdominal pressure, such as coughing, sneezing, or lifting. A common question is, do you ever lose urine when you cough, sneeze, laugh, or lift something heavy? Urge incontinence involves a sudden, strong urge followed by involuntary leakage, and is often associated with conditions like BPH. You might ask, do you have a strong urge to urinate and sometimes leak before reaching the toilet? Overflow incontinence presents as dribbling due to incomplete emptying or over-distension, commonly seen with diabetes, neurological conditions, or severe BPH. A helpful question is, do you feel like your bladder doesn't fully empty, or do you experience frequent dribbling of urine? Lastly, functional incontinence occurs when physical or cognitive limitations delay access to the toilet. That means there is no underlying physiological issue with the bladder. You might ask, do you ever have accidents because you can't get to the toilet in time or can't manage your clothing? Understanding these patterns helps guide clinical reasoning and management decisions.
From here, we can look at cystitis, which is an acute infection of the bladder. Pain is typically felt in the suprapubic region. Key features include dysuria, urinary frequency, or urgency. What's important to understand is that systemic symptoms are absent or vague, such as low-grade fever, which helps distinguish this from upper urinary tract infections. These conditions still require an urgent referral. The triad is suprapubic pain, urinary changes, and dysuria. Next, we'll look at bladder cancer. This is a chronic condition, often associated with risk factors like smoking. An important point here is that the key finding for bladder cancer is painless hematuria. Patients may also report urinary frequency or urgency, but without signs of infection. This requires an urgent medical referral for further evaluation. The triad comprises painless hematuria, urinary changes, and the absence of signs of infection. Let's look at urethritis. Urethritis is an acute inflammation of the urethra, often related to infection. Pain is more localized to the urethra, and patients typically report burning with urination. Key features include dysuria, urethral discharge, and irritation or itching. Some cases present with urinary frequency or urgency or hematuria. A helpful thing to remember is that suprapubic pain is typically minimal or absent, which helps distinguish this from kidney and bladder involvement. The triad is dysuria, urethral discharge, and localized urethral irritation.
To wrap up, remember to start with the location of pain, which helps identify the likely organ or structure involved. Then determine whether the presentation is acute or chronic. Acute conditions tend to be more abrupt and severe, while chronic conditions are more gradual and persistent. From there, look at key features such as pain, urinary changes, including frequency or urgency, and whether systemic or constitutional symptoms are present. This approach helps you quickly recognize patterns and narrow the diagnosis. Hopefully, to make it easier to remember, we can simplify each into a triad.
To close, let's apply this framework using a few examples. Start with the location of pain, then determine whether the presentation is acute, and look for key features. For example, acute flank pain with fever suggests pyelonephritis. If the pain is colicky without systemic signs, think kidney stones. If a patient presents with dysuria, urinary changes, and suprapubic pain without systemic signs, that points toward cystitis. And if there is dysuria with urethral discharge and minimal suprapubic pain, think urethritis. This approach helps you quickly narrow the diagnosis.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.